Hi, Dr. Thomas. So my name is Savannah Peters. We're in our first clinical rotation, which I'm super excited about. I'm doing women's health first, and I'm with Jean Marino. She works at UH Landerbrook, and I've done 2 days of clinical so far, and I'm already loving it, which is awesome. So some strengths I wrote down. I like to say I'm very personable. I'm really good at making patients and family members feel safe, feel free from judgment, especially in a women's health office, where sometimes people can be like nervous to talk about things and stuff like that. I'm also pretty good with Epic charting. Now I don't have access yet. I'm hoping by Friday that I do. But I worked at the clinic, which already had Epic, and then when I came back to UH as a nurse, they implemented Epic, so I have pretty good experience with that. And then I'm pretty good at a basic assessment, right? Like heart, lungs, abdominal assessment, which is all the things that we include when someone comes to a women's health office. Some weaknesses or areas for improvement, I would say specifically like breast and gynecological exams, just because I haven't had experience in that yet. I actually have already done one pap smear. That was a great experience, but obviously I want to keep doing those to get used to those. I also want to learn how to chart specifically, like from a provider standpoint. So like prescribing meds, writing a full H&P, like the stuff, that we really don't do as nurses. And then I just want to learn more about women's health. Jean has really opened my eyes up to the lack of knowledge that a lot of people have regarding menopause. I also feel like STI screening and stuff like that sometimes has a negative view, and there's not. I think as women, we need to come together and be able to talk about those things and be open to be able to help each other, because menopause is a very real thing, and I've quickly learned that. And even for me, I'm going to be 31 soon, and I barely know about menopause, besides what we've learned in school. But I definitely think there needs to be more exposure for women, and for women to come together and realize that it's a real thing, and you're not crazy, or, it's definitely a hormonal imbalance, and there's ways to help with that. Plan for improvement and meeting the course objectives. So I want to begin charting on my own while I'm speaking to the patient. I've noticed a lot of outpatient is about like being able to multitask and be able to do both, because you do have a lot of people you have to see throughout the day. So I want to work on that. I'm going to work on doing more exams on my own. I'm already doing like breast exams and then, basic assessments, but I really want to be able to continue to do like vaginal exams, pap smears, that kind of stuff. Just continuing to ask questions to Jean related to women's health, because she's so knowledgeable in that, and like how she diagnoses and prescribes meds, like what's her method to getting there. And then I always want to use evidence-based practice to guide my care, because that's what the accurate, correct research is. And I think incorporating that, and like I've noticed Jean really does that. She always brings up like data that she's read, or evidence-based research, and I think that makes the patients feel more comfortable, because there's so much stuff online, especially with women's health, like, oh, try this supplement, try this, try that, and it's like, well, what's real, what actually works? Like, should I be spending $500 on this, or is there a better method? So I think that will help improve patient outcomes. But yeah, I'm really excited for the rest of this rotation. I actually like women's health a lot more than I thought I was going to, which is kind of cool and surprising, because I've only worked in PACU and neuro ICU, so my experience is very different. I will say, though, I love being on the other side. I'm definitely ready to be a nurse practitioner, so I'm just excited, and yeah, I look forward to the rest of the semester.